Hello, and welcome to the County Health Rankings and Roadmaps 101, using data, evidence, guidance, and stories to build healthy communities. My name is Attica Scott, and I'm a community coach with County Health Rankings and Roadmaps. In a moment, I will share just my slides with you so that you can follow along with the presentation. County Health Rankings and Roadmap program is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. We would also like to acknowledge that this program is a result of the contribution of many colleagues and partners in Wisconsin and across the nation. Thanks to their support, we are able to bring you this webinar today. I'm joined today by a small team of colleagues. Together, we will be talking about how County Health Rankings and Roadmaps works to improve health outcomes for all. So let me welcome my colleagues. Dr. Annie Rubel is a population health analyst. Jessica Rubenstein is an evidence analyst with What Works for Health, and Karen Odegaard is a community coach with Our Action Center. So if everyone would say hi after I say your name, we'd appreciate it. So Dr. Annie Rubel.
Hi, good afternoon, everyone.
Welcome. Dr. Jessica Rubenstein.
Hi, everyone. Happy to be here.
And Karen Odegaard.
Hi, Attica. Thank you so much, and thanks for being here, everyone.
Welcome. I'm so glad to have you. And our colleague, Joe Hinton, is also helping us out today by watching the questions box, and our partner, Joanne Lee, is watching the chat box. So I'm going to turn it over to my colleague, Karen, who is going to walk you through a few of the technology opportunities with the Zoom webinar.
Sure. So we just want to take a moment to get you used to the Zoom webinar attendee interface. If you joined us a few minutes early, you saw a video introduction. And for those of you who are just joining, we will do just this real quick overview on how you can be an active participant today. So we'll start with submitting questions. If you want to submit a question to any of the panelists, you can simply click on the Q&A control in your control panel. When you do, the Q&A box will open up, and you can simply type your question in at the bottom there. Then click Send to submit your question, and we would love to hear your questions throughout the webinar, so please send them in at any time. And then we can go over to the chat. So the chat feature, Attica, if you want to click to the next slide.
I will do that.
Thank you so much. You can use the chat to make comments or respond to questions that we may ask you, the audience, during the webinar. To use the chat feature, you can click on the chat control. When you do, the chat box will open up, and you can type your comment in here. Then you can simply press Enter to submit your response or your comment. Remember that we use the chat to make comments or respond to questions that we may be posing to you, and we want to encourage you to use the Q&A function to ask your questions of us. You'll have the option to chat with all attendees or with panelists only, and we ask that if you're comfortable, please chat with all of the attendees so the other participants can see the ideas that you are sharing. And finally, we want to tell you about the Raise Hand tool. You can raise your hand to respond to a quick poll. For example, we may ask, how many of you have seen your county snapshot? If you have, simply raise your hand by clicking on the raise hand button. And you don't have to worry about lowering your hand. We'll take care of that for you. So why don't we go ahead and give that a try. We'll have you raise your hands if you have seen your county snapshot. Oh, look at you all. That's awesome. So we've got a well-versed audience who has seen their county snapshots. Almost half of you have taken a look at your county snapshot. And if you haven't yet, then we'll encourage you to do that. Today's webinar will give you some direction on where you can find it and what you can get out of your county snapshot. Fantastic.
Thank you so much, Karen. I appreciate you.
Thanks, Attica.
Yep. So our learning outcomes for today, now that you've been oriented to how you can be an active participant in our webinar, are first, we want to make sure that you understand who we are, what we do, and why we do what we do. And we also want to make sure that you're prepared to use the data, evidence, guidance, and stories to support your work. So why do we do what we do? We do what we do to improve health outcomes. That's why county health rankings and roadmaps exist. It's why we produce the tools and resources that we do to support communities. And county health rankings and roadmaps has two primary overarching goals. And the first is to improve health outcomes. And this includes both how long people live and how healthy they are. Our second goal is to close the health gaps between those with the most and least opportunities for good health. We believe that everyone should have a fair opportunity to be as healthy as possible, regardless of where we live or the circumstances we were born into, and that the choices we make depend on the opportunities we have. Things like access to healthy foods or a quality education, or living in safe and affordable housing and crime-free neighborhoods. Not everyone has these opportunities. These unequal opportunities create differences in health, and they don't come about on their own or because of the actions of individuals alone. They are often the result of policies and practices at every level that have created deep-rooted barriers to good health for some people. We see this in things like bank lending practices, school funding based largely on local property taxes, and policing and prison sentencing that have perpetuated discrimination. That means that everyone does not have a fair and just opportunity to live a long and healthy life. But communities have the power to change this. Think about your own community. Who is not thriving? Who doesn't have the same opportunities for health? What barriers have been put in place over the years? What will it take to remove those barriers and change the opportunities in your community? What opportunities do you see in your own community for closing gaps in health? Go ahead and chat in now some of those opportunities that you see, and make sure to chat to all attendees so that everyone can see your responses. So, what do we mean by health equity? Let's paint a picture. Imagine a place where everyone has a fair and just chance to lead the healthiest life possible. Communities with high quality schools, good paying jobs, access to healthy foods and quality health care, and affordable housing in safe environments. Imagine a place where differences in race, culture, and perspectives are not only tolerated, but are celebrated as fundamental to health and well-being. Imagine that this is how we all experience our communities, regardless of where we live, the circumstances we were born into, or how we look. This is the vision of health equity. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. Achieving health equity means reducing and ultimately eliminating unjust and avoidable differences in health and in the conditions and resources needed for optimal health by improving the health of marginalized groups, not by worsening the health of others. Our progress toward health equity will be measured by how health disparities change over time. So we have new state health reports that provide data on differences in health and opportunities in all 50 states that can help identify where action is needed and to achieve greater equity, and offers information on how to move from data to action. And you'll hear more about that in a moment. But I wanted to pause here, Karen, if we could, and see if you wanted to share a few highlights from the chat box.
Yeah, definitely. There's a lot of really great chats going on here. Everything from Nancy talking about access to mental health care for marginalized populations to affordable housing providing are proving to be a barrier. Christopher chatted that in. There's opportunities to build new partnerships. I love to hear that, thinking about working with hospitals and food, retail, restaurants. That was from Carly. And then, you know, things like access to safe trails of recreation areas, access to jobs, especially for those who have been incarcerated. There's so many opportunities that people are seeing in their own communities about where they might want to take action or where action is being taken to address equity.
Thank you so much, Karen, for sharing those highlights, and for everyone who is chiming in the chat box with your examples. So I want to share a graphic that helps understand why equality is a starting point to closing gaps. We need more than the same resources or opportunities available to all. For example, an adult bike would not allow everyone to ride safely to get to where they want to go, and some could not even ride it at all. And also, our youth are the argument for why we need to focus on equity. Our nation's youth is becoming even more racially diverse, and because we know that children, youth, and families of color do not have the same opportunities and are often much more worse off when living in segregated communities. Then finally, investing in all youth by giving them fair opportunities to thrive will ensure a healthy and prosperous future. So we talked about the why, so now we will look at the what and the how. As I mentioned, one of our goals is to improve health outcomes. So let's look more closely at this. We use two key images to think about the what and the how of creating healthy communities. The image you see here is our rankings model. This helps us understand what makes the drivers of health in a community. One of the goals we have had with this image is to help change the conversation about health and what influences health. What this image shows us is that health is more than what happens at the doctor's office. A wide range of factors influence how long and how well we live. It includes things like we often think about when we hear the word health, healthcare, and how well we eat and how much we move. But we know it's also things like education and income, the quality of our housing, and the safety of our neighborhoods. And equity shows up in many of the health factors that we're talking about. So next, I want to share our Take Action cycle. This is our how of creating a healthy community. When you look at this Take Action cycle, everyone here has a role in addressing equity. We believe community transformation begins with the steps in the Take Action cycle, starting with assessing needs and resources and moving through to evaluation. Communicate and work together wrap around the cycle because these activities are essential throughout, no matter what step you're in. At the heart of the Take Action cycle is people working together. We know that when people work together with a shared vision and commitment to improve health, it can yield better results than working alone. While these images might look pretty simple, we know that putting these ideas into practice is challenging. And so we've developed various tools and resources to help you. We will take a look at these tools and resources in just a moment, but I first want to check in with Joe to see if there's anything popping up in the chat to share.
Yeah, we're seeing some good conversations just about really leaning into equity. We are definitely seeing some people still reflecting on the approaches that they've taken in their populations. So we've got some great conversations still going on.
Wonderful. Thank you so much, Joe, for giving us those highlights. So we at County Health Rankings and Roadmaps work to support communities to bring people together to look at the many factors that influence health, select strategies that can improve health for all and close gaps, and make changes that will have a lasting impact. We do this by providing data, evidence, and guidance for communities. We also work to gather and share stories of communities around the country that are at different points on this journey to serve as examples and inspiration for you and your partners. We're going to go deeper into each of these areas. But first, we would like to get a quick sense of how familiar you all are with these different types of resources using the raise hand feature that we mentioned in the video intro as well as Karen's intro. So first, raise your hand if you are familiar with and have used the data resources, the rankings, your county snapshot, or measuring progress. This is awesome. Thank you. And again, you don't have to worry about putting your hands down. Joe will take care of that. Okay. Now, raise your hand if you have used our evidence resource, What Works for Health. Okay, all right, thank you. And finally, raise your hand if you've used the guidance resources, the Action Center, the Partner Center, or you've worked with the coach. Okay, thank you for raising your hands. We appreciate you participating, and we hope that you each learn about some new resources that you can access to support your community's journey to improve health. So finally, before we jump into our deeper dive into each of these resource areas, I want to show you quickly where you will find these different tools and resources. Annie will go briefly to the website when she discusses our data resources. But we are not doing a full website tour today since we just provided a web tour earlier in the year. But I do want to show you some basics to point you in the right direction.
Attica, can
Yes.
I jump in for a moment?
Sure.
Before you do that, could you, some folks are noting that they're having trouble seeing your slides, and so we wanted to see if you could stop sharing and then restart your sharing and see if that resolves the issue.
Okay.
Thank you.
Sure. How's this, Karen?
Okay, I'm gonna turn to the audience for some help to see if if people can see this, because I haven't had a problem myself, but I'm hearing yes, but much better. Oh, good. Yes. Okay, we're back in business. All right. Thank you so much, Attica.
Thanks, Karen, for making sure that folks can see the slides. So again, we will not necessarily do a full website tour today, but we've definitely got members of our team who are going to show you pieces of the website. But what I do want to highlight is that you will find our data resources primarily under the Explore Health Rankings tab at the top left-hand side of the page. The evidence and guidance tools and resources that Jessica and Karen will discuss, What Works for Health, the Action Center and Partner Center, are all in the Take Action to Improve Health tab, the second tab in the orange bar at the top. You will find stories as well as links to upcoming and past webinars in the Learn from Others tab. It's the second to last tab. And if you need some additional background in understanding or thinking about health and what influences health, you will find that under the What is Health tab, the last tab to your right. So we're now going to explore each of these areas with Annie from our rankings team, Jessica from our What Works for Health team, and Karen from our Community Transformation team. For each of these areas, we will get a sense of why it's important, what we have available to help support your community work, and how to make the most of resources. We'll start with data. In our work with communities, I get a lot of questions about data. Why is data such an important resource for communities? And so this is my first question to you, Annie. Why is data such an important resource for communities?
Well, Attica, thanks for that great question. And as a data analyst on the team, I hope I can provide some of the resources we have. But data can be used all throughout formal and informal community health improvement processes. First, it can be used to assess the health of a community. Communities across the country are incorporating county health rankings data into community health needs assessments, as well as other health improvement strategies. And I saw in the chat that some of you have noted that you've used some of our data for those things. Data can also be a tool for engaging communities in health improvement. The rankings prompted a sense of urgency for the United Way of Greater Toledo, along with the community it represents in Ohio. The rankings model became a tool to talk about the social determinants of health and how to respond. Data can also help identify root causes of health issues. So the Menominee Nation of Wisconsin, a 2015 Culture of Health Prize-winning community who used the Adverse Childhood Experiences Scale as a screening tool to measure children's exposure to traumatic experiences, found many members with scores indicating a high risk of health problems. The tribe then decided to take a trauma-informed approach to health, which focused heavily on consistently evaluating the mental and emotional health and well-being of residents. Data can also support decision-making and policy change. And finally, it can track progress. As communities take action, they have used data from the rankings and other data sources to understand whether policies, programs, or plans are on track to improve health.
Thank you for that, Annie. So I've certainly seen communities using data for all of these reasons. So how do the county health rankings help communities use data?
So that's a great question, Attica. And there's some examples on this slide, but I think it's better if I take us now to the website and give you a quick tour. So it'll just take me a second to share my screen here and take you live to the website. So are you seeing the County Health Rankings website now, Attica?
I am. Let's check in with Karen to make sure that everyone else can see the website.
So far, so good.
Thanks.
Perfect. So I'm going to go live to the website because all our data is there and all our resources. And the rankings has its own landing page, which Attica pointed out before. So if you click on the Explore Health Rankings tab there way on the left, it'll take you to the rankings portion of our website. And here you can find all our reports. We have annual reports that come out each year. You can find information on how to use the data and some tutorials on what we rank, our methods if that's of interest to you, why ranks change, all our data in databases if that's helpful for you, or we can just go to finding the county health rankings. So Attica, what state should we look at today?
How about my home state of Kentucky?
Perfect. So you can just start typing in your county or state there. As you can see, it'll autofill for you. So we'll click on Kentucky, and it takes us to the state landing page. And here you'll find two maps always, a map of health outcomes and health factors. Lighter colored counties are the better ranking counties, just to orient you to those graphics. You'll also on the state landing page find the state reports, which I'll talk about a little bit more later. And then you'll find some state-specific resources as well as a contact in your community who can help you either with county health rankings data or finding other resources that might be helpful.
Great, thank you, Annie. So can you talk a little bit more about what the state data resources and the community health improvement resources are that I see here on this page?
Yeah, so our team knows that the county health rankings is really just a starting point, and we'll jump into a snapshot in a second. But we also include this Finding More Data section, which has state-specific resources, data resources and community resources that we've located within your state if you want more information on specific topics to dig deeper. So now I'll jump to a snapshot. So Attica, what county should we look at in Kentucky?
I live in Jefferson County. How about where I'm from?
Sounds good. So you can either type in your county here or scroll, but Kentucky has quite a few counties, so we'll type it in. And this brings you to your snapshot, and this is really the bread and butter of what the data team does at County Health Rankings and Roadmaps. And so I just want to orient you to the snapshot itself first. So on the left, you'll see all the measures that we include in the rankings. And you'll see some additional measures that are hidden under these plus signs. So feel free to open those and play with them. These are measures that we include but aren't included in the rankings. So there's more data. The whole snapshot is very interactive, so feel free to click on things. And you'll probably find more data and more tools than I'm just going to highlight today. The first data column here will always be the value for those measures for your county. The second column will have trend graphs, and you can see that they're color coded, red, green, or yellow, and I'll talk more about those in a bit. Then there's an error margin column, as well as a top US performers, which is the top 10th percentile, as well as the value for your state, so the value of Kentucky in this case. And finally, the last column has your rank. And so when I go to a county, I often look at the rank to get a big picture of what's going on. So we see for health outcomes, Jefferson County ranks 28th out of 120 ranked counties in Kentucky. So that's pretty good. And then we can look down for health factors where they rank 42nd. So still in the top half, but perhaps we can look at, figure out why they might be ranked a little bit lower for health factors. And we can look at the health factor areas for those. So health behaviors, we see 38th. Clinical care, we see 5th. They're doing really well there. But maybe we need some more work here in the social and economic factors and the physical environment where we see higher ranks. And what I encourage people to do with the data is to go in and look at the specific measures. So let's just start at high school graduation here. If you hover over it, you'll see a definition of that measure. And you can see here the percentage of high school graduation for Jefferson County is 79% compared to 89% for the state. So that might be contributing to that poor ranking in social and economic factors. So we want to start by looking at the data for your county, and it can start explaining why those ranks are there. Another tool I want to just highlight quick while I'm here is the children, for children in poverty, but any measure here that is highlighted in blue with the underline, you can open up and get data by race where it's available. So you see the children in poverty measure for Jefferson County is 21%, but if you look among Black children, it's 44%, or among white children, it's 13%. So there's additional data tools within the snapshot itself, and that gives you a picture to start looking at data by race and talking about equity within your community. Another tool I just want to highlight, I'll scroll back up to the top of the snapshot here, are the trend graphs, like I said before. And you can click on these and use them, take them, put them in reports or put them in presentations if you'd like. But this provides data over time. And we include this for measures where we have at least 5 years of non-overlapping data and track the measure over time. So you can see here for premature death, you'll always see a line for the county, which is the orange line with the X's, a line for the state, which is the green line with the plus signs, and then a US value. And you can see over time that Jefferson County is pretty much following the state of Kentucky values, but maybe slightly better. But you see that there's a difference between the US values and the state and county values. We might be slightly concerned about this uptick and start asking questions about what's going on there.
Yeah, there might be some slight concern. But there are a lot of measures here, Annie. So how's the community supposed to know which measures they need to focus on?
That's a great question, Attica. And helping communities define their focus is a multi-step process that has to look at both what the problems are and what solutions might be available unique to your community. We provide some tools like the trend graphs that I showed, and then we provide some other ones that can also give you a head start. Up at the top of the snapshot here, we have areas to explore and areas of strength, and you can click those and turn them on. They'll highlight the measures in orange or purple respectively. And they highlight what measures might be particularly worrisome or particularly good when compared to state or national averages. And these comparisons are not intended to replace the true priority setting process, but they can give you a quick peek into areas that are strong or weaker in your community. And I'll just turn those off. And another thing you can do is compare your state value, as I started to do with high school graduation, to both the top US performers or the state. So for premature death, for example, which is the years of potential life lost before age 75 per 100,000, you can see the value for Jefferson County, 8,800, which is similar to the level in Kentucky, but worse than the top US performers. And again, this is the top 10th percentile, or as we like to say, what you might need to get an A for that measure. So it's another benchmark for you to strive towards. Finally, I want to highlight our Compare Counties tool, which can be useful to do this as well. So up at the top, you'll see the Compare Counties tab. And I'm going to take us back to Jefferson. And you can do this for all the ranked measures and the additional measures. It has the same data that's on your snapshot with less columns. And you can either choose from a list of suggested peer counties, or you can choose any other county in the US, and you can put in more than one county here. So it's if you're a county that you know that there's another county like you in your state, or you border another county that you would like to get comparison side by side, this is a good way to do it. And so that data is side by side for all the measures, again, for all ranked or additional measures. And I just want to scroll down, and then I want to tell you that we're also going to go to a measure page, and you can do this from the snapshot as well, but we'll do it from here. So we'll do children in poverty since I showed you that breakdown by race before. Again, our website's very interactive, so you'll find many different ways to come to the same pages. And a measure page for children in poverty, for example, here is always going to take you to a map first. And the map is the same as the health outcomes maps. Lighter colors are better performing counties. So here, darker counties have higher percentages of children in poverty. But there's also a data tab. So this tab shows you the data table for that measure for your state. And you can sort by county alphabetically or backwards alphabetically, or you can sort by measure value. So we'll just sort there to show you. There's always a column for trends if they exist. And similarly to the snapshot, you can open those up. There's an error margin column and a z-score, as well as where it's available, again, that data broken down by race. So this data table can be really helpful if you want to look at the values across your state. Another resource here is our description, which has the data definition as well as the reason for ranking and some measurement strengths and limitations. And if this isn't enough for you, feel free to click on the Learn More About This measure. And that has information about talking about this measure, why it's important to health, if you want to talk about it to a non-public health audience, or if you need some information about where you might get data on smaller geographic areas, it's all included in that Learn More About This measure. The data source tab here just includes information about where we get the measure from and how it's calculated. And then there's the policies tab, and I'm not going to spend too much time here because my colleague Jessica will talk more about this later. But really, this is a place where you can go if you've decided you want to work on this area, or if you want to see what other people have done who are working on this area. What kind of interventions can you do as a community to help improve health? So the measure page and the snapshot page are really the crux of the rankings website, but there's definitely plenty more to explore. And I hope that I hope you'll spend some time there on your own to find information for your own state or county. And Attica, I'm going to ask you to go back to the slides so I can just briefly talk about the state reports as well.
Okay.
And so while Attica's doing that, I'll just give a brief. The state reports again are on your state report page, or on your state page. If you just type in your state, you can find the PDF version or an online version. And last year we worked really hard to upgrade these. And one thing we did was include racial data for your state to begin to talk about equity, not just by place, but also by race and ethnicity.
And Annie, I'm going to ask if you see my slides, and then Karen, do you see anyone who's commented that they have not are not able to see the slides? So Annie, can you see them?
I see them, Attica. Thank you.
Okay.
Looking good.
Okay, thanks.
Yeah, so briefly, there's many more figures in the reports themselves, but this is an example of a figure by teen birth rate. And you can see the distribution within Kentucky by race. So Hispanic, Blacks, and whites have worse teen birth rates compared to Asians. You can clearly see that. And you can see that distribution compared to counties within Kentucky as well as counties within the US. So it gives us a pivot to start talking about equity.
Wow, this is really interesting, Annie, and I feel like even though I work at County Health Rankings and Roadmaps, I've just learned quite a bit. So for the state health reports and this particular measure, is something like this available for other measures?
Yeah, so we included this data in the state reports for all our health outcome measures, as well as some additional social and economic measures. So they're available for teen birth rate, children in poverty, and high school graduation, and uninsurance for this year. And again, they can be found at countyhealthrankings.org on your state page.
Great, thank you so much, Annie.
And then if you go to the, oh, thanks, Attica. You're one
Sure.
step ahead of me. So yes, so rankings are a great starting point to draw attention to the problems that matter in your community. And we don't want you to stop at the data. The data really need to drive to action. So now I'm going to turn it back over to Attica to go to the What Works for Health program, who help to provide the evidence needed to make decisions on the best programs and policies in your community.
Thank you so much, Annie, for the overview of the data resources. So once a community understands its challenges and strengths and has figured out what they want to work on, they need to know what they can do, what strategies they should implement. And one factor in deciding what to do is understanding the evidence of how effective a strategy has been at changing outcomes. So we're going to turn to Jessica now, one of our evidence analysts, to walk us through our evidence resource, What Works for Health. So before we jump into What Works for Health, let's start with the basic but important question, Jessica. What is evidence?
We hear this word evidence a lot. Evidence-informed, evidence-based, terms like proven, model, and promising. This word has different meanings to different people in different organizations who work in this space. So before we dive in to what evidence means for us, I'd like to take a minute to ask you to think about what evidence means for you. We'll do this with a poll. This poll asks about what's important to you when you're making decisions about your personal health, but it can also apply to community health improvement. We'll pop some options up on the screen in a Zoom poll. You can select as many answers as you'd like. There are no wrong answers. And the question is, what criteria would you like a physician to use in deciding how to treat you? All right, it looks like our answers coalesced around the third, fourth, and fifth options. So when we in What Works for Health think of evidence, we focus on options 4 and 5, the results of controlled experimental studies and critically reading the literature. They are important components, but as many of you indicated, not the only thing that should be considered.
Thank you so much, Jessica. So as a program, we believe that evidence matters. So could you tell us more about that?
Evidence can help us drive smart investments and stretch the impact of scarce dollars. It can help inform decisions about when to adopt tried and true options and when to be more innovative, and to inform innovation. Knowing what's been shown to work and what hasn't can help to ensure that innovative solutions are effective.
Thanks, Jessica. So I've mentioned what works for health a few times. So what exactly is what works for health?
At its core, What Works for Health is a tool to help communities make decisions about the strategies they can use to address local health priorities, and do so without reinventing the wheel every time. It really makes harnessing evidence easier for communities.
So what does what works for health have for communities looking for evidence to inform their work?
What Works for Health provides a menu of ideas, summarizing the available evidence and providing examples of where strategies have been implemented. When I say strategies, I mean policies, programs, systems, and environmental change. We're a living resource, always updating our current strategies and adding new content. And as of today, we have over 400 strategies available.
Wow. So what does each strategy include? What will people find when they click into one?
So for each strategy on menu, we include an evidence rating, which conveys the likelihood strategies will work based on best available evidence. It's core to what we do and how this resource can be useful. It indicates which strategies have been shown to work, those that might work, and then those shown not to work or to cause harm. We have a short literature summary that highlights who a strategy can benefit, what it can do, and as we have it, information about cost. And we also include disparity ratings to help communities use an equity lens as they explore strategies. And then we have implementation resources to help communities move from ideas into action. So this is a slightly shortened version of our mixed use development strategy summary. We're not going to walk through all of the details today, but this is just a quick glimpse of what all of those elements I just discussed look like when they come together to form a strategy.
So Jessica, that is a lot of information. So how can communities make the most of it?
We like to suggest an approach that we think of as evidence plus. So this approach connects the evidence you find in each strategy with your local culture and context. As you explore what works for health and read specific strategies, you'll find content to help support this approach.
So how do you do that?
Start by asking questions like, does this strategy work? Will it work here? Then look at the details. Evidence ratings show you the likelihood a strategy will work based on the best available evidence. And there's a field called expected beneficial outcomes that will show you what a strategy was rated for. And then confirm that these outcomes matter to you. Reading the evidence of effectiveness summary can help you know if a strategy is likely to work locally. Do you see populations like yours? Communities like yours? Then disparity ratings indicate the likely effects on disparities or gaps in expected outcomes. And implementation examples include toolkits, model policy language, and illustrations of how communities have put a strategy into action.
Great. Thank you so much, Jessica, for taking us through that What Works for Health walkthrough.
You're welcome.
So we've talked about stories being one of our resources. And understanding what other communities are doing is important as well. And so Annie shared a few in her data overview. And so now let's look at how communities can use what works for health in a variety of ways. So I've got two quick examples that I'd like to share from groups that are working with our coaches. So in Sitka, Alaska, their team used what works for health at their annual health summit to help inform goal selection and consensus. And because it is a very accessible and easy to use resource, it can be great to use with larger community groups to inform the group discussion around strategy selection. Another example that comes to mind is from the Health Foundation of LaPorte, Indiana. They use what works for health in their grant-making process so that local organizations could search for program and policy examples to inform their pursuit of grant funding. We know many funders want communities to use evidence to inform their work, and this can take a lot of the legwork out of that process for you. So here's some key takeaways from what works for health. So evidence is an important part of decision making. What works for health provides information about what works, what might work, and what does not work. You should connect the evidence available with your local culture and context to maximize effectiveness. Okay, so we talk about data and understanding community needs and assets. And we talked about using evidence to understand what communities can do to change outcomes. So where does guidance fit into this picture, Karen?
Thanks, Attica. So the work of transforming communities is not easy. We see that every day in our work. But we believe that by supporting communities with guidance about how to take action and who to work with, that we can help accelerate their progress toward improving health outcomes and health equity. So Attica showed the take action cycle a few slides back, and this image really illustrates how communities transform health. And at its center, we can see who has a role to play in making it happen. Our Action Center and Partner Center are both grounded in the Take Action cycle. So you may recognize this as a fairly basic community change theory. The guidance that we provide helps communities work through each of these important steps in community change and to consider the different types of people to work with along the way. So we also know that action is not always linear, and sometimes these steps overlap and sometimes you go back and forth, and that is all okay. But we do believe that it's important to understand not just your community's needs, but also its resources. To select priorities, we think it's important to select priorities because if everything is important, nothing is. And we think it's important to look at the evidence when considering what to do. But as Jessica said, it's not just evidence, it's also important to consider things like local context and priorities when selecting policies and programs that will work for you. And all of that work gains meaning when we actually take action on what is important and learn whether that action is doing what we set out to do. So we provide guidance in a few key ways. So for example, we provide learning opportunities like this one and other webinars, as well as interactive discussion groups. We have our online action center, which we're going to walk through and talk about next, and our partner center. And then we also provide coaching support. So today I'm going to be focusing on our online action center and the partner center, and we'll touch briefly on coaching support.
So Karen, how can people get the most out of the Action Center?
Yeah, so the Action Center, which again you'll find under Take Action to Improve Health on our website, and this provides step-by-step guidance and tools to help you move with data to action. So we walked you around that Take Action cycle. You will find a step or a guide for each of those steps in the action cycle. And each of those action steps is further broken down into key activities with guidance and suggested tools to support your work. The point of the Action Center is really to answer the question, how can we take action? So I like to think of the Action Center as a destination. When you get there, take a look around at the steps that can help move your community forward. And think about where you see your efforts. For example, are you assessing your needs and resources or trying to choose effective policies or programs? Then those guides are going to be the most useful to you. You can also think about where you're feeling a little bit stuck. So maybe you're having trouble moving from the assessment phase into actually planning and implementing a policy change or a program that you've selected. If that's the case, then you're going to want to dip your toe into act on what's important. Many of us struggle with the work of keeping our partners engaged or recruiting diverse stakeholders to our work. So that's where our Work Together guide can help. But the point is to use what you need at the moment and then get back to work. Get in, find some guidance, find the tools that can be useful, and then get back to it. And know that this will be here for you the next time you face a challenge or you are ready to head into your next step.
Thanks, Karen. So I know there's a tip that you like to share. So could you share that tip with
Yeah,
folks?
definitely. I suggest once you get into the Action Center, set it as a favorite in your browser so you can come back often. It's a resource for you to, like I say, get in and out of and to find what's useful to you in the moment and then get back to work.
Great. Thank you so much. So just to share a quick example from one of the teams that we coach that use tools and guidance from the Assess Needs and Resources Guide in Escoda County, Michigan, the coalition was well aware of the challenges in their community, but what they needed to understand were the assets. So working with their coach, they turned to the asset-based community development tool in the Action Center to help frame their process for understanding individual and community assets that they could build on. And this process helped them build momentum for community events and to open doors for collaboration. So we're going to turn to the Partner Center that Karen mentioned in just a moment. And as we do that, use the chat to share which steps in the Action Center are a challenge for you right now. So if you just go into the chat box and just share, what steps in the Action Center are challenging you right now. And as you do that, let's talk about the Partner Center and what kind of guidance people can find there.
Yeah. We all have a role to play in creating healthier communities. And by working together, we can achieve more than we can working alone. The Partner Center, which you can also find under Take Action to Improve Health on the main navigation bar on our website, is all about joining with others to make lasting change in your community. It answers the question, who should we work with? So if you think about the people in your community who make positive changes happen, you can call them leaders or change makers, maybe you call them stakeholders, whatever you call them, these are the people you want to partner with. But how do you reach them? Well, you start by doing some research to find out what their goals are and how they might align with yours. And you think about what's in it for them. And then you find a way to get connected and begin to cultivate a relationship. The Partner Center can help you get started. It provides guidance around why different sectors might care about creating a healthy community, what they can do, and how you can engage them.
So Karen, how can people really get the most out of the Partner Center?
Well, many of us play different roles in our communities. We might work in healthcare, but also serve on a government board. We may work for a nonprofit that also serves as a funder. So I suggest starting with the roles that you play in your community, or explore the different sectors that you want to be in partnership with. And if you aren't sure where you see yourself in the sectors listed here, remember that we are all community members. So start there.
Thanks, Karen.
Yeah.
So Karen, did you have an audience check-in question here, or?
I do. Yeah, I
Okay.
have a poll, but I wanted to skim the chat to see what steps folks are thinking about from the Action Center. And I see some folks talking about work together, which to me goes hand in hand with the Partner Center. So if you're thinking you're in work together or you're trying to recruit folks to be partners with you, I would spend a little time in both places. I also see people talking about acting on what's important, which, I mean, Attica, we see this every day when we're working with communities, that is a challenge for people to actually get to implementation. So lots of good stuff here. I also am noting the time. So let's quickly go to a poll to find out which sectors folks are interested in partnering with. And then we'll move on to our key takeaways here in a moment.
Thanks, Karen.
All right. Great. So we're seeing a lot of interest really across the board. A lot of people are interested in how they can better partner with their community members, with community development, healthcare. Those are some of the ones that I'm seeing pop up to the top. And why don't I'm gonna let it go for one more second, and then I'm gonna end the poll and let you all take a look at the results. All right. So yeah, community members, I think this is such an important area that we work with communities on a lot, is how to best engage the residents in your communities. So I love that people are really interested in that one, and I suggest hopping in and taking a look at that one. It's a great way to get started.
I agree.
I'll just say a word briefly about our coaches. This is another key way that we provide guidance, and we have a team of coaches that can help strengthen communities through online guidance and virtual learning opportunities. If you need a thought partner to help you get unstuck, to think about how to use any of the resources we talked about today, you can always reach out to us via the Contact Us form, and you'll find the Contact Us button at the bottom of our website. So you can find that button. That's my tip on this slide. You can find that button anywhere you are on our website. So always look for the Contact Us, and reach out to us to let us know how we can be helpful to you and help you make the most out of the resources we have on countyhealthrankings.org.
So Karen, do you want to share the key takeaways from the section that you went over?
Sure. So the guidance that we provide and countyhealthrankings.org helps to answer questions like, how can we take action through the Action Center? And who should we work with through the Partner Center? And our coaches can help you connect with any of the resources that we talked about today.
Great, thank you so much, Karen. And folks, we know that you've chatted in some questions, and in a moment I'll share with you information about the discussion group that's coming up next, where you'll really be able to dig into those questions that you have about why we do this work or how we do this work. But before we segue into the discussion group, I do want to share with you that we have a learning opportunity, and we encourage you to register for this upcoming learning opportunity. So it's our next national webinar that will take place on November 20th from 3 to 4 Eastern, and will be an opportunity for you to learn about how the Allen County, Kansas prize-winning community has created opportunities for residents to embrace their power and act collectively. And you can access the registration links to upcoming webinars, as well as recordings to past County Health Rankings and Roadmaps webinars via the link that you see on this slide and that Joe is chatting out to you right now. So we also have an exciting learning opportunity which is taking place right after this webinar. So immediately following the webinar, we will offer a post-webinar discussion group to provide you with an opportunity to continue to ask questions and dialogue about County Health Rankings and Roadmaps 101. So note that this is a conversation, and it's different than our webinar because it will be a facilitated interactive discussion in which you can share what you are doing locally, as well as ask questions of other participants. And we're pleased to be able to offer these focused discussion group sessions in partnership with Healthy Places by Design, and Joanne Lee with Healthy Places by Design will be our lead facilitator. So please plan to attend. Just click on the link you see in the chat box, complete a few quick registration questions, then you will be taken into the video conference. Video conference is highly recommended so you can meet others and talk face-to-face to help build a strong network. Our capacity is limited, so head on over immediately following this webinar. And so finally, we encourage you to stay connected with us. Like us on Facebook, follow us on Twitter, sign up for our e-newsletter, and we'll chat out a link for you to sign up for the e-newsletter. And we thank you for your participation. We ask that you complete the feedback survey that you will receive via email. And we'll appreciate you completing that, because your voice really helps us ensure that the webinars, discussion groups hosted by our partner Healthy Places by Design, and other supports we provide to community meet your needs. You can also share your input with us anytime via the Contact Us form on our website. Thank you all so much, and we'll see you in the discussion group.